I work at Children's of Alabama and UAB and with adolescent medicine. And I did my fellowship in adolescent medicine, and during that I spent a lot of time working with substance use, drug and alcohol use, and on prevention and treatment, and just I'm just honored to be here, and I'm glad to be able to talk with you guys a little bit more. A lot of things in my talk is similar to Dr. Taylor's, and I'll try not to repeat anything, but there's some additional things I think that would be important to hear. So I appreciate your time. I can figure this out. I don't have anywhere to put the mic, so I'm going to have to stay kind of close. Okay, so again, this is repeating what you've heard, and you all are here, and so you know this already, but parents are the number one influence in their child's life. Children are less likely to use drugs if their parents talk to them about the dangers associated with drug use. That's exactly what we've been saying, and so I'll just reiterate that. That's my main point. So in my talk, and I'll keep it brief, I think, since we've already talked about some of the things I plan to say, is that we wanted to go over what medications are commonly misused or abused, and you'll see in addition to opioids, there's some others to know about and think about. We'll discuss why adolescents use these medications and where they obtain them, because that's important to know. And discuss what parents and practitioners can do to prevent misuse of medications. So at first I thought, well, I like to use the word misuse sometimes more than abuse, because sometimes again it's a spectrum of kind of where are we experimenting, are we really using them appropriately. So I would say that any time someone is taking a prescribed medication differently than it was originally intended, that would be an example of misuse, or taking someone else's prescription. So I know that I as a physician hear that a lot, it's no big deal. Just today actually, I heard an adolescent tell me sometimes my mom will give me half her Valium, that type of thing you guys have heard about a lot. And then taking an over-the-counter medication in the same way that you're not using as directed on the label. So any of that I would classify under misusing a medication. So what are some medications that are commonly misused or abused? And these are the main categories, and I'm just kind of going to go through each of these and give some examples so you guys can hear names, and if you have any to add or questions, of course, say something. So, and each of these has its own separate slide. So we just heard a little bit about opioids, and again, commonly prescribed after procedures and trauma. I thought about the dentist as well, because I feel like my husband has had a series of root canals, and we ended up with probably 5 bottles of hydrocodone in our drawer, which that was my fault, because I'm like, I've got to get these back to to get rid of these medications, especially kids. I have little kids, but yeah, sometimes you will just end up with just inordinate amounts of extra medication, which we'll talk about again, and I reiterate the things that Dr. Taylor said to you earlier. So again, opioids should never be used for pain that's long-term. They're, in terms of, you hear about chronic pain, like chronic low back pain, or pain that's been occurring for months. And it's never recommended to use these type of pain medications. I've put some side effects there that all of you know about, and then examples. So I listed a few, just again, I wanted to put names so you guys would understand. They're different medications. You need to look at what's in each trade name for medication. Like if your bottle says Percocet, then know that that is an opioid. That has hydrocodone and Tylenol in it. So codeine cough syrup I brought up because of the age we're talking about here. I assume it's not common practice for a pediatrician to be prescribing codeine cough syrup a lot these days, and even when I was practicing at UAB College Health, seeing older individuals, I don't know of anybody who prescribed that, but you'll see that still being prescribed a good bit for adults, so cough medication that's actually an opioid. And I hear about it a lot, or I used to a few years ago with some populations, and like a drink that they call lean. I don't know if you guys have heard of that, but where they mix codeine, young people mix codeine with like Sprite and Jolly Ranchers. And so if you hear about lean, or that's what they're talking about, it's usually codeine cough syrup. I just, again, wanted to mention a few examples. So what about stimulants? So these, I'm sure that you all have heard of these. These are medications for attention deficit hyperactivity disorder, and narcolepsy is another example. Like if you take a stimulant, it's not always necessarily because you have ADHD. You could have another medical condition that would benefit from a stimulant. But so these side effects include increase in alertness and energy. Your blood pressure can be higher. Your heart rate can be higher. Your appetite can decrease when you take these. I know if any of you have family members on these medications, you know what I'm talking about. But again, some adolescents can become addicted to these medications, or misuse them in a way where they're experiencing euphoria or a high from taking these medications not as prescribed. And these are, I just mentioned they come in short and long-acting versions, so there's the spectrum of types here. But just a few examples, again, things that you guys have heard of, I'm sure, Adderall. And these are trade names just to help you identify the medication better. And I've given the generic name before the trade name. Okay. One thing, I'll go back to this for a second. One thing about stimulants, because I took this slide out, just to understand, there is some thought out there that perhaps stimulants could help as a study drug, I'll say. So again, I worked with college students for a few years, and this is one of the most common things that we would see in the clinic is students coming in asking about ADHD. Can I be tested for ADHD? I want to be on, I get a medication for it. So it's come up that a lot of students have the idea, young people have the idea that taking stimulant medication, even if they don't have ADHD, is actually going to bump up their performance. I'm going to stay awake all night because I'm going to be, and I can get this medication, and not always, as I'll bring up in a minute, not always from the physician, but from their friend or someone else. And there's actually been some studies that have shown that if stimulant medication are taken by children or adolescents who do not have ADHD, it actually worsens mental performance based on some different scans and blood flow changes to brain regions. When they gave it to people who did and did not have ADHD, there were just differences, and it actually impaired mental functioning more so in those who took it who did not already have ADHD. So I hope that came across to you guys correctly. But so I would, I guess, come back at your students or your children, whoever, who tell you, well, these are going to help me stay up and study so I can do better. Because I'm telling you, as one of the physicians at UAB College Health, that's so often that's the goal, is to I've got to achieve, perform. There's a lot of pressure, and they end up thinking things like a stimulant are going to help them get there. So just to bring that up as something that now you know, well, if you don't actually have ADHD, it's actually going to make things potentially worse for you. So just a little bit of information there. All right. I think I stopped it too long. It was telling me I needed to go faster. Okay. So this class of medications, I just grouped them together as sedatives, and they're typically prescribed for things like panic reaction. I feel like Dr. Taylor would give this talk a lot better than me because she did this all the time. For panic reaction, anxiety disorders, or sleep problems. So really the takeaway here is I wanted you guys to know about benzodiazepines. And those are things like I mentioned, Valium earlier is an example. But clonazepam, lorazepam, any of those ending in pam, usually, you can see that those are going to cause relaxation, sedation. People use them, again, sometimes for sleep problems. They work well for people who have panic disorders a lot of times. But one big takeaway about sedatives or benzodiazepines I wanted to say is that benzodiazepines are not first-line medication for anxiety disorders. And so that's just a piece of knowledge that they are addictive when taken when misused or not taken correctly, when experimented with and along the spectrum. When they're used in combination with alcohol and things like that, they can be very dangerous and for overdose. And when you take benzodiazepines regularly, if you stop, the withdrawal from benzodiazepines is life-threatening and deadly. So again, benzodiazepines are a dangerous class of medications, and I would ask a lot of questions as a parent, going back to our opioid discussion, with advocating for your child while you're at the physician's office about what the medication is. Is this the best medication or the only option for my child for this problem? So again, I just wanted to bring out that for generalized anxiety disorder, it's not recommended as the first medication. And again, I'm not the expert on that as much as Dr. Stephen Taylor is, so you can ask him the questions. Okay, so other medications I wanted to bring up were just mostly over-the-counter medications. Some of these aren't. Sleep medications aren't over-the-counter, but the big one I wanted to pull out, and I go like, what is this robot with the bottle? This is, I looked up, I was just Googling robo-tripping, which is what it means to overdose or to misuse dextromethorphan, and sort of, I guess that's just a term that a lot of kids use for, it's robo-tripping again. But dextromethorphan is in a lot of over-the-counter cough and cold medications. Again, I'll list it out a few names, nothing against Robitussin, but just wanted to bring out, again, how even over-the-counter medications can sometimes, and we have seen them misused by young people if they're trying to achieve a high or euphoria, if they drink enough of it or take enough of it. And even, Imodium or loperamide can do the same, cause euphoria and higher than recommended doses. Diet pills and laxatives, I won't go into, but just another example of something over the counter. Again, I work with eating disorder patients as well, and we ask about this a lot in that setting, but just thinking about those things as you see what's in your home and as you see what might be with your child or that they may have with them or what they have access to. Just, again, always being on high alert and knowing, staying one step ahead. I'm going to skip this. It's like a minute or minute and a half long YouTube video, just reiterating. It's a story about a young man who did pass away of opioid overdose. But this comes from the Medicine Abuse Project. And the Medicine Abuse Project, I would recommend you guys go to that website. It's under the Partnership for Drug-Free Kids. That's a really great website. It has a lot of videos that I would recommend looking through. I really, enjoyed it myself. I think I hit it all. There we go. Thank you. Okay, so just a couple slides on statistics going into what children or adolescents use and sort of some numbers, and the most recent numbers I could find on who reported misusing prescription drugs in the past year. And in 2016, when you just looked at 12 to 17-year-olds, and this was a national survey done across different parts of the U.S., it was only about, I said only, but that's still more than we like, right? About 6% of 12 to 17-year-olds reported that they misused a prescription medicine in the last year. And again, of course, most parents believe their child has never taken a prescription drug for a reason other than its intended use. And another statistic, of course, of those who start using heroin, 80% started by misusing prescription drugs. So just to time what we've already said here, a note on brain development. I know Dr. Wally mentioned this a little bit as well. And this is just an image that shows you the differences in color or how the different areas of the brain mature over time. And just bring it home. This says age 20 at the bottom here that I would just take home that at age 20 the brain is still developing and the adolescent brain doesn't fully mature until 24, 25 years old. And the reason why we're talking about this and why I talk to a lot of people about this and how important it is to prevent drug and alcohol problems in youth is because their brains are developing and they are at higher risk of becoming addicted to these medications and to drugs and alcohol because of that. And there's different pathways that are forming and things that are maturing. They're changed, they're halted, and they're at high risk of addiction in this stage. And that's why I think as pediatricians, we should be thinking of this more and talking about it more. And so I appreciate you guys all being here and being so interested in it. And then again, this is from the same survey where students said that they that the source where they found the medication that they misused. And there's a lot of numbers there, but I tried to just point out, again, in the red are the younger populations. They split out 12 to 17-year-olds in this survey from the young adults. And I like to see young adult data too, because that, for me, that counts as my patients. Those are still, our kids, 18 to 25-year-olds. And across the board in both age groups, for stimulants, opioids, and sedatives, they're getting these medications that they are not using correctly. They're getting them from their friends or from a relative. So they're finding them from their grandparents, their parents, or again, especially for stimulants, from probably a friend, just from my anecdotal experience. So that's the takeaway there. They're getting them from your home or from their grandparents' homes or from their friends' home. So they're usually not buying them off the street from a dealer, and they're usually, again, they are getting them from doctors, but the majority is things that we can prevent. That's what we're here to talk about. So now this is some of the things that Dr. Taylor's already talked about that you guys, now we know, that we can prevent as parents. We can prevent this from happening by educating ourselves, which is why we're here, by monitoring use of all medications. And I asked a local adolescent psychologist, Heather Austin, about what one takeaway would you tell this group that I'm going to speak to about preventing medication misuse. And she said that. She said there's so many patients that she's seen and that we've even shared ourselves that their parents allowed them to manage their own medications. And that's a big no-no. A big no-no. That would be the one thing she would share with you. So I'll just say it again because I think it's worth saying. And then tell your friends that too. Spread the word. That's when you hear, so-and-so's daughter is in charge of her own medications. Just be the advocate for your friend group and your community. Secure the meds safely in your home, as we talked about, and then dispose of the medication properly. So go to Walgreens and dump all of that extra hydrocodone out. I'll give you a link at the end of the talk, and really it's through found it through the Healthy Home and Coalition website that has a link there on the website of local dispensaries where you can take, or local area places where you can take dispose your prescription meds as well. And then what are the bags called again? I haven't heard of them. The Terra bags that everyone got when they come in. I think that's great. I've never actually seen one, but that just shows you I needed to know myself. Okay. Yeah, I know. I got rid of all those hydrocodone bottles. Okay, and then what can practitioners do, or physicians, or providers? Again, education I think is so important, and that goes along with advocating for your community, for your family. But track and monitor prescriptions written to your patients. So I felt like I would be wrong if I didn't mention that as we prescribe these controlled medications like pain, like opioid, all the things I mentioned really, opioids, stimulants, benzodiazepines, that we should be looking up on the prescription drug monitoring program. We should be looking up and ensuring that our patients aren't getting stimulants from another provider in another county somewhere that I don't know they're seeing. So that's something all physicians should have access to and be able to do in this state. And I just say that I just wanted to bring it up. I felt I'd be remiss if I didn't. Partner with you all, our community for prevention, and assess our patients for problems when they come in, like screen the patients we see for substance use issues and talk to them about it. And I put a note about Naloxone here, because Naloxone is a medication that is a reversal agent if you do have an opioid overdose, and it's saved many, many lives. Many more can talk more about it than I can. But I just wanted to bring that up because a lot of times we should be thinking as physicians when we prescribe pain medications like opioids, we should also be prescribing Naloxone, telling them about pharmacies that have Naloxone, and I'll just leave it there. And then, again, this goes back to Dr. Taylor. I just said, again, how do we advocate as a partnership? So the parents and the providers are partners. How do we advocate? And this is exactly what Dr. Taylor said. I won't go into it again, but it's all about how long do I need to, when you're prescribed a medication for pain or for whatever, asking if there are other options. How long do I need to take this medicine? Can you only give me a small amount so I won't have a lot left over? How much will I need? What happens? What are the risks of misusing this medication? And again, knowing the risk in your family of substance use problems. Do you have a family history of substance use problems? And then just being aware and talking about that. Know about appropriate anxiety treatment. Again, that was just a little plug because I wanted to bring that out just so you guys can advocate for your child in terms of medications they're prescribed. And again, the provider should be telling the family if there's a potential for misuse with a certain medicine they prescribe to you. Okay? And these are some resources. I don't know if you guys get a copy of this, but again, medication disposal, if you'll just look up Healthy Hormone Coalition, I'm sure there are other places locally, but I just felt it was easy to find there. And I would highly recommend looking at the Partnership for Drug-Free Kids just for a lot of information. And then there's some other good resources. I'll look it up for a second. I think that's all I had. Again, that was my takeaway. Thank you guys so much for letting me